A very good evening, everyone. I'm Sayukta from Radiance with You YouTube channel, and I'm sure all of you must be keeping good health. Today, let's dive into a topic that affects a lot of people but often doesn't get enough attention: hair related disorders. Whether it's hair thinning, dandruff, or conditions like alopecia, these issues can have a big impact on both our physical health and emotional well being. And just like with fungal infections, the earlier we take action, the better are the results. Hair disorders can range from mild to severe, affecting people of all ages and backgrounds. Things like stress, hormonal changes, poor diet, or even environmental factors can contribute to hair problems. Some of the most common conditions, including hair loss, both temporary and permanent, dandruff, and scalp infections, which can cause discomfort, itching, and even embarrassment. But here's the good news: just like with any health issue, awareness and early intervention are the key. We can take steps to prevent hair disorders before they start, or at least minimize their impact. By understanding the causes, adopting healthy habits, and using the right treatments, we can protect our hair and maintain its health for the long term. Let's focus on how we can prevent hair related disorders, recognize the signs early, and explore the latest treatments and solutions that can help restore and maintain our hair health. Whether it's better scalp care, nutritional improvements, or seeking professional advice, we all have the power to care for our hair and keep it looking its best. So let's connect today with our skin expert, Dr. Jeeban Jyoti Mishra, who is an MBBS MD from AIIMS, skin venerology, leprosy, and cosmetology, ex senior resident at CBMCH, Cuttack, assistant professor KIIMS, and currently he's practicing at Varenya Skin Care. A very warm welcome to you, Dr. Jeeban Jyoti Mishra.
Thank you.
Doctor, it's such a pleasure to host you. And today, as we are going to talk about a very common, yet, much prevailing, and people become so embarrassed at times and they are into depression because they have hair issues. To start with, doctor, which hair disorders are commonly seen in practice?
Nowadays, we are seeing more of androgen alopecia
Yes.
and female pattern baldness.
Okay.
Both disease presentation is in the young age, and young age is more conscious of their cosmetic look.
Okay.
But the concerns like dandruff, that is with seborrheic dermatitis, alopecia areata, that is the patchy hair loss on the local area, and some cases like teenage case of children age group. These are the common diseases that we are seeing.
Right. So, doctor, how common is androgenic alopecia, male pattern hair loss, female pattern hair loss?
For example, I am seeing 100 patients of together,
Yes.
out of which it is about 50% patients are because of the issues, like physical pattern and androgen. Rest of the cases belongs to either infection or any other.
Okay. Right.
Ma'am, is there echo from your side?
There is no eco problem, but more of a network glitch, I guess. We'll see if we can get a more steady video of yours, doctor. So let's continue with the topic because we are talking about alopecia. So, in which age group is this type of alopecia common?
The common age group is usually young age group. It's about 30 or 35. But nowadays we see alopecia areata cases even in the very young children, maybe of 1 year or 2 years age. also we are seeing in the elderly population. The common age group is the young population. In those cases, this is commonly seen, irrespective of the male or female, irrespective of any gender.
Right. Doctor, what are the predisposing factors for this type of alopecia?
For alopecia, it's largely autoimmune disorder where the body immunity plays a role. The lymphocytes that are the major soldiers of our body immunity, they attack the hair follicles, especially the black hair follicles, the young hair follicles, and they get it destroyed. But it is a reversible change. With treatment, we can cure it.
Right. Doctor, we often say that hair or our scalp is a reflection of what is going on inside our body. So, if we are healthy, it will get reflected on our hair or scalp. If we are not healthy from within, then we see various problems in our scalp or hair quality as well. So, is this type of hair loss related to any health disorder or due to any medication?
In alopecia areata, as it is autoimmune disease, it is largely unpredictable. Sometimes any antigen that act as an allergen has a hidden role. For example, a person in stress has more chance of getting alopecia areata. Those patients are having vitiligo, any thyroid disorder, some of the systemic autoimmune disorder like HIV, rheumatoid arthritis. So those patients have a more risk of getting alopecia areata as a coincidence with other autoimmune disease or as a single disease as alopecia areata. Hence, infection and stress has a direct role with alopecia areata.
Okay. Okay. And doctor, now if we talk about the management, how is this type of alopecia managed? So today we are talking about hair
Am I audible now?
disorders. Yes, yes, you're audible, doctor. If we can know the management options, how you manage alopecia, this type of alopecia.
Ma'am, you're asking for alopecia areata or in general for alopecia?
Yes, doctor. In general,
In general, if we tell what is the causes of alopecia, the largely it is due to nutritional deficiency. Sometimes it is due to the hormones. Sometimes it is due to the infection, or sometimes it is associated with some of the symptoms. So, if we'll further elaborate, for example, a person is having insulin deficiency, anemia, that is the low in hemoglobin, low in iron, low in vitamin B complex, or in particular biotin, low in vitamin D3. So, they suffer more. Similarly, some of the hormonal conditions like androgenic alopecia, in which testosterone in the male plays a role, in female pattern hair loss, where some of the female hormones play some role, and in some of the syndrome, that is the PCOS syndrome, as polycystic ovarian syndrome. So there hormone plays a role. Some of the autoimmune diseases like alopecia areata, where immunity plays a role, and some of the infections like tinea capitis, where fungal infection plays a role. So the causes are wide. We have to find out the cause, and then we should approach to treat from the root so that there will be adequate improvement.
right. So these are the problems, and if we can address the problem, of course the solution lies there. And medically, of course, there are so many treatment options available to take care of it as well. Because today we are talking about hair related issues, and we have with us Dr. Jeeban Jyoti Mishra, who is telling us what are the problems and how to manage them. Which type of scalp injections are more useful or effective, doctor, if you can tell us?
Nowadays, there is wide use of PRP, that is known as the platelet-rich plasma, which is
Okay.
derivative of own patient blood, where separate the platelet-rich plasma content from the rest part of the blood. Before that, we do a process of centrifugation, where we collect the blood and rotate it in high frequency, in about 3,000 to 4,000 rate per minute, in which the fluid part gets separated, we collect it, and we inject it to the patient's scalp. Another commonly used injection is the GFC, growth factor concentrate, which is the little modification of the PRP in which there is externally some growth factor concentrate artificial added.
Okay.
Similarly, two other injections are the radiotherapy and the exogens. So these four injectables are nowadays commonly being used. It was not that common previously. For about 2 years ago, there were less use of these injections, but nowadays these are commonly injected by the dermatology. Another injection is the triamcinolone injection, commonly used in case of alopecia areata, in which there is little amount of the injection. The interval is sometimes needed to complete the disease. So basically, these five types of injections that are commonly used by the dermatologist to treat the hair disorder.
Right. So these are the various injections that work actually on our scalp. But doctor, how soon we see hair growth after these injections? Because this is a very common tendency. Of course, if we are going for any procedures, then we want to see the results as soon as possible. So how much patience, how much time is required?
Diet has a predominant role in controlling alopecia, especially when it is related to nutritional deficiency. Is it vitamin biotin? Is it folic acid? Is it vitamin B12, zinc, calcium, or vitamin D3? All are related to our diet. Even low concentration of the protein, low concentration of the iron intake can also increase the hair loss. Hence, iron-rich food, a balanced diet, stress-free life, these are the necessity for treating a case of alopecia.
Dr. Mishra, if I can request you to rejoin the link, doctor, because there is some network glitch, and many times, we are not getting your audio or visual properly. So if you can just, rejoin from the same link, that would be great for us so that we can fix the network issue. So, ladies and
Okay.
gentlemen,
Should I
today we are
rejoin?
talking. Yes, yes, please, doctor. So there is some network issue, but then we are having a very informative session with Dr. Jeeban Jyoti Mishra on hair disorders and how to fix it, what are the root causes, etc. But then there is some network glitch, and we don't want to lose any words, which he is putting forth for all of us, because it's very informative, as hair is a big concern for most of us. So in case you have hair issues, please don't delay. In case you see thinning or pattern baldness, please feel free to contact a qualified dermatologist, trichologist. They'll help you fix the problem, because it's important to understand what is causing the hair loss. And once you know what is causing, then of course you can address that particular problem. Plus, there are various procedures, various treatment options, even medications that help. But we should not go for DIYs or home remedies, and we should go with what a qualified doctor is asking us to do. Welcome back, Dr. Mishra.
Thank you.
So, Doctor, we were talking about these scalp injections, and you told us that how these, various injections can be useful or effective on our scalp, and when we can see hair growth after these injections. So, how commonly, Doctor, hair transplant is done for hair loss? Because many of us know about hair transplant, but then we don't know how effective it's going to be.
A hair loss has been divided into multiple stages. Okay. So if it is towards the late stage, like stage 5, 6, 7, then there is less chance of getting the complete hair restoration with only topical agent, systemic capsule or tablet, or any injectable. In those cases where there is late stage, the recovery chance is less. In those cases, we should go for hair transplantation. Or there is some conditions, some scarring alopecia causes where even after treatment also there will be no recovery. In those cases, we should advise the patient to go for a hair transplantation. If it is in the stage 1, 2, 3, even up to stage 4, then we can restore it. The alopecia can be improved with only medications and injectables.
Doctor, what are the chances of recurrent hair loss even after treatment?
So basically, we have to find out what is the cause. For example, the cause is nutritional deficiency. A person is having a dietary habit in such a way that he or she is having multiple episodes of dietary deficiency. We gave some treatment in form of some vitamins or any supplements. The hair fall improved and patient recovered from the alopecia. Again, the patient has the same diet practice, hence patient will land up again into the further nutritional deficiency. For example, we commonly see a patient is having anemia. We treated it with folic acid, vitamin B12, with some protein supplement and as well as iron supplement. Patient recovered. Patient hemoglobin reached up to 11 or 12. After 6 months, it again came back to a anemia level. So we have to change in our dietary habit, and also there are some disorders like alopecia areata, which is recurrent in nature. It will come and go. Hence, it is the nature of the disease and it is the dietary habit of the patient that decide the recurrence and the efficacy of our treatment. Hence, we have to go for a further follow-up in 3 to 6 months to assess whether our treatment is effective or whether there is any recurrence of the alopecia.
Okay. Doctor, what are the challenges in the management of alopecia?
The challenges we face that we have to sometimes go for a detailed investigation.
Okay.
Nowadays, the clinical examination is a skill. Apart from that, we have to take some of the investigation to reach the root cause. For example, a person might be having hypothyroidism. We have to do a thyroid test. We have to check whether the hemoglobin is low or not. What is the iron status? What is the vitamin B12, vitamin D3 level? So we have to do lot of investigation. Sometime to find out whether PCOS is associated, we have to do a ultrasound. Sometime we have to do some hormonal test also, that is costly. So these are some of the limitations while treating a case of hair disorder. The another limitation is the chronicity of the treatment. Sometimes we have to treat a patient up to 1 to 2 years. And the another problem is sometimes when you stop the treatment, there is again the recurrence of alopecia. So these are the three limitations that we face while treating a patient clinically.
Right. Now, I will talk about some of the issues that are commonly faced by common people. And one of the very, very common thing that we come across in our day-to-day routine is while brushing, combing, or even washing our hair, we see a lot of hair shedding. Is it normal or we should be alarmed, doctor?
up to 100 hair loss per day is normal.
Okay.
But we should think it cautiously that is it happening for a longer time and multiple number of hair, even more than 100 strands per day is falling, then we should be serious and concerned about our alopecia. Otherwise, up to 100 hair loss is normal. Sometimes you will see some of the visible change on the scalp. Sometimes people count the number of the hairs, but you should assess it. Is it a chronically happening or it is a acute episode? Sometimes a person getting a admission in the hospital, patient is on stress, or patient is having a episode of fever. For the next 3 to 4 months, there is increase in hair loss, but it is absolutely normal. Patient will recover with time. But if it is happening and continuing for more than 3 to 4 months, then we should be worried. So up to 100 hairs is
Hmm.
normal.
And many a times, doctor, we see pattern thinning, from where we do partition. Many a times we can see here thinning from that, the partition broadening. Many a times we see at various parts or portions of scalp that we are losing hair. So these all are alarming things where we need to go and consult a qualified dermatologist.
Yes, you are rightly told that this central parting, that there is a partition, especially in the female patient, it get widened with age. Sometimes it is due to the some of the female hormones. Sometimes it is associated with polycystic ovarian syndrome. So in those cases, we have to find out the hormonal issue. You have to give some supplements if needed, and we may give some of the treatment like minoxidil, some of the hair serums, and if needed, some of the injectables.
Right. Because you mentioned supplements, I would like to ask one more question to you, doctor. And that is that nowadays, because there's so much of information floating over social media, we have DIYs, we have various influencers, not all of them are qualified dermats, but they love talking about skin, scalp, hair. And they will ask us to pop up biotin supplements. They will say that that it's really good for your hair, or other gummies are so much into trend these days. So what's in your opinion, are these gummies or biotin that we buy over the counter and start taking without any prescriptions, do they really work?
Actually, there is studies are going on. The study says that the supplements have a limited role. If you are finding clinically or from the investigations that this patient is having low in hemoglobin, low in iron, low in vitamin B12, low in folic acid, vitamin D3, or calcium, then you treat it. Giving a wide range of supplements without finding the cause would cause more harm to the patient rather than making the patient more improved. Nowadays, with the evolution of the social medias and AI, there is much of misinformations than the correct informations. Hence, one should follow a dedicated, authorized, certified dermatologist who he or she would guide you about the supplements. Otherwise, these are costly. It can cause harm also. It can cause your liver injury. Sometimes much of the vitamins would cause some of the acneiform eruptions. Sometimes some are allergic to these. Hence, giving a lot of supplements would not make you much healthy. Rather, it will take your cost from you.
Right, and plus we waste a lot of time. We'll take biotin
Yes.
supplements for say for 6 months, and then we will go and consult a doctor saying that nothing is working out. So those 6 months wasted is actually going to cost us anyway. So please don't do that. Don't do what social media influencers are telling you, etc. Because it's important to know why hair loss is happening in you, and we all are different, and of course the causes are going to vary. So please better go and consult a qualified dermat. Another thing which is very common in our society, and I'm sure Dr. Mishra, you'll agree with me, is to go by what our friends or family members are saying. Many a times they will come up with their prescriptions that, I also had the same issue. I went to the doctor, here's the prescription. So I'm not asking you to go for anything. I'm giving you the correct prescription. Go buy it and you'll get cured. So why do we need, doctor, a individualistic approach in treatment?
What happens? Sometimes a little modification of the prescription is also very important for the patient. For example, I am giving one patient a topical minoxidil with some iron supplement. Another patient is not having a issue with iron, so he or she might need only minoxidil with a biotin. Now the iron that he or she is consuming from a from his fellow or from his colleague or from the another person's prescription is a little bit extra. It will cause a more damage rather than helping you. Hence, a prescription copying from another person's when it is not needed, so these medications might harm you also. So in that aspect, it's better because the cause of the hair fall, ultimately the hair will loss, but we have to keep it or we have to preserve it in those time in our young age. If up to even now the elderly persons also are very cautious about their hair loss. So if you want to preserve it, you have to take a proper treatment and we have to find out the cause. Without knowing the cause, giving a blanket therapy with multiple supplements and topicals will not help.
Right, right. And Dr. Mishra, what kind of diet we should go for to have good hair health?
The diet should include much of the micronutrients and vitamins that is plentifully available in the green leafy vegetables and fruits. Also, our food should be rich in iron and protein because iron will improve our hemoglobin and hemoglobin will improve the nutrition part that is essential for the hair. Also, it should be rich in protein because if protein is not there, it is an essential part of the hemoglobin, and also our hairs are made up of proteins only. It is made up of keratin, which is a protein. So, adequate amount of protein-rich food, adequate amount of green leafy vegetables that is rich in antioxidant and vitamins are necessary.
Okay. There are people who have their own queries, so I'll take few of the questions by our viewers. One is by Aditi Srivastav. Could stress, diet, or medication be contributing to hair loss?
Yes, yes, Aditi, it's a very nice question. I appreciate your question because this is exactly what you can change. You can have a stress-free life that is contributed to the hair loss, and you are responsible for your own diet, and you can change it. As I told, that green leafy vegetables, fruits, and iron-rich food are essential part for restoring your hair.
Okay. Adi Jan is here, and his question is: does styling hair regularly cause the hair damage? And if yes, what can we do?
Regularly styling what causes that it is sometimes break your keratin protein. Sometimes there is some sulfide bonds in between. Sometimes it will break the bonds. For example, your hair is curly and you made it straight. How you made it straight? By damaging these bonds and rearranging the bonds. So in that process, sometimes there is weakness in the strands of the hair, and sometimes it can cause hair loss also. But regularly means it how regularly. Doing once or twice a year is okay. But if you start doing it every month, then definitely it is going to harm you.
Okay. Geetika Sharma is here, and her question is: can oiling help prevent hair loss?
Oil is essential for maintaining the smoothness and the shininess of the hair. Actually, oil does not nourish our hair. The nourishment gets from the blood, from the cutaneous blood supply that is under the scalp skin. So, oil is essential only to maintain that shininess. Hence, once or twice application of the oil is adequate and it has no direct correlation with the hair loss. From the ancient ages, as Indians, based on our culture, we used to apply hair oils. It while applying it, we do massage also. So this friction and this massage increases the blood flow. So indirectly it helps. But from the studies, it has been found, but it is not that effective that we should go on applying hair oils almost every day. Once or twice is enough.
Okay. Usha Patel is asking, I have scalp problem during winters. What can I do?
What happens in the winter season? There is about 30 to 40% less moisture in the environment. So, in that environment, because of the coldness and because of the dryness, there is increased risk of fungal infections. That is the Malassezia. Malassezia name as a fungus. It's a species commonly found in our scalp, and in that cold environment, in that dry environment, it grows well. So, what it causes? It causes some of the inflammation on our scalp, and we tell it dandruff. So we have to be cautious in the winter season. We may apply some of the antifungal shampoos, some of the antifungal lotions, and if it is in excess amount, you may take some of the antihistamines and some of the antifungal tablets or capsules.
Okay. Now, Dr. Mishra, before we wrap up the whole session, any take home message, any do's and don'ts for good hair health?
Yes, hair is actually not that essential for us. Hair, nail is not that essential. In a life which is full of opportunity, you don't concentrate much on the hairs. This is my first advice. The second advice, the hair is part of our life. For example, I am going to give an interview. So if my hairs are less, I might have some of the issues with my confidence. So in that way, it is important. But it is not that essential like heart, kidney, brain, and liver.
Absolutely.
Okay.
Hmm. Right.
So don't take much of your stress. Now the world is biased towards the cosmetic, their look, their hair, their skin. So just maintain a normal life, treat when it is needed, maintain a balanced diet, try to be live a confident life with a stress-free life, and consult a doctor when needed, and don't grasp much of the data information. Don't flood yourself with much of the information from the social media. Rather,
Right.
a doctor's opinion with limited and less amount of medication, much of the diet, and much of the stress-free life is helpful in restoration of your confidence, restoration of your hairs.
That was wonderful, Dr. Jeeban Jyoti Mishra. Thank you so very much for your valuable time. It has been really a very informative session for our viewers. It was great to hear you. Thank you once again.
Thank you, ma'am. Little bit of issues with internet. Sorry from my part, but it was a very much enjoyable session, and I hope that the audience have enjoyed this session. Thank you.
We hope the same, and we really look forward for more of such sessions for our viewers with you. Thank you once again.
Thank you. Thank you, ma'am.
And viewers, thank you for your participation in today's session. Stay connected to our YouTube channel and do not forget to subscribe. Radiance with you. Thank you and have a great evening ahead. Goodbye.